and this is LiveWell Talk on emergency care during the COVID-19 epidemic. I'm Dr. Ryan Sundermann, St. Luke's Hospital Emergency Department Medical Director.
And I'm Dr. Ryan Dowden, physician in the ER at St. Luke's also.
So today we're taking over Dr. Arnold's, our Chief Medical Officer's podcast to discuss what we're doing in St. Luke's Emergency Department to ensure your safety and to ensure that you're getting the care that you need to get in the event that you're not feeling well. Because we've definitely seen a decrease in our volumes in the emergency department during this time, understandably, because people are scared. They're afraid that they're going to contract something even by coming to the emergency department.
Yeah, I think some of it's that. I think also that social distancing is maybe keeping people well or less injured than
Right.
normal.
They're not going to work and smashing their fingers or falling off of roofs or even getting in a car accident on the way to work.
Yeah, exactly. And not to mention that, we're taking extraordinary measures to prevent spread of viruses. So I think it goes without saying that there's a decent chance that even the kids that we normally see with colds and flus and things aren't getting sick because of the same precautions their parents
colds.
are taking for coronavirus social distancing.
Those are viruses as well, and the same social distancing works in the same way for the common cold virus, et cetera. So.
Yeah. But we certainly miss our patients, and we definitely don't want people staying at home for symptoms that under normal circumstances they might not even bat an eye to come to the emergency department to get checked out for.
I think we could definitely talk about some of the things that we've seen that would have been much way more severe because people didn't present early. But I think, and one of the features is that people are trying to do the right thing. They're trying to make sure that sick people have access to the emergency department. They don't want to get sick by coming to the some sort of healthcare facility. I mean, you see it in Hy-Vee or the other grocery stores. You walk down the aisles, you got to follow the directional arrows. You got to wear your mask, and people are kind of, they look at you sideways if you're not wearing a mask in there, and you got to wipe down your car. So naturally, if that's just from the grocery store, they think about coming to the hospital. I think, yikes.
Yeah, exactly. And I'm sure people have driven by and seen our shed out front in the ER and seen signs and maybe heard stories about how the processes are different. And of course, that can potentially raise anxiety levels about coming in, create indecision. Is it safe? What's it going to be like? What do I expect when I get there? And so I think that's a good thing. We're going to talk about some of this stuff and the steps that we've taken.
I think that's exactly the point, though, is that we've done all those things to keep people safe. Not only prevent people with minimal symptoms from having to come into the emergency department. We have a shed. You've seen a lot of tents out in the public. We actually have a shed because some of the strong winds we've had in the last month tried to blow our tent away, and so we moved to a shed that's pretty much locked down.
Yeah, maybe not a good idea to have a tent during April and May thunderstorm season in Iowa.
The worst place would be maybe Texas or Oklahoma. So we've put those in place to keep well people moving through without even having to come to the department. But we've also split the waiting room in half, and so we've got patients that if they come in with any respiratory symptoms and they can't go right back to the emergency department, they can go to our respiratory waiting room where they're masked and they're distanced far apart so that they're outside the cough radius, which is the distance that droplets spread, but they're in a mask anyway. We put a mask on them if they're in that waiting room. But because of the low volumes, we haven't even had to use our waiting rooms. And then we have a waiting room as well, where if you have a sprained ankle or a cut or something, you can go to that waiting room. So we've split the waiting room in two, but all of our rooms are private rooms. You're not sharing rooms. They're decontaminated. They're wiped down completely after every visit. And then if there is a respiratory patient, we even have what's called a negative pressure system, where it basically pulls fresh air through so that nothing actually gets out of that room. And so any respiratory patient, none of whatever they were to respire even gets out of the room. So it's extremely safe. In fact, our rate of illness as healthcare providers in the emergency department is actually very, very, very low. And that's because of our protective equipment that we're using and what we're doing to keep the rooms clean and the people isolated.
Yeah, I think it's important to note that the purpose of this recording isn't necessarily to talk about the signs and symptoms of coronavirus and the illness itself, but rather to kind of talk about the precautions and everything that we have in place to keep all of our patients safe. And as the medical director, Dr. Sundermann, works a tremendous amount. But in March alone, he worked double the number of hours that he normally does in preparation for coronavirus. And quite frankly, The disease process itself is evolving, and even as doctors, we're getting new and updated information on the disease every day and best practices from around the country and so forth. And obviously, we're very focused on that. But ahead of time, when we look back now, 6 weeks ago, before social distancing started, when we knew that the disease was coming and that we were going to prepare for a surge, a big focus of the preparation at that point in the emergency department and in the hospital as a whole wasn't necessarily preparing for how we were going to actually take care of these patients. In other words, what medicines we were going to give them and what symptoms we were going to expect and what we were going to do, but rather the preparation was all in place to try to figure out how we were going to deal with this contagious disease and keep it from spreading to our healthcare workers and to the other uninfected patients.
Yeah.
And so the vast majority of the work preparing for this was all done for that reason.
Yeah, you saw the efforts in people trying to get the protective equipment. I was going out and buying masks and goggles and things like that just to make sure that we had enough. And you saw the public outpouring when then people are, once people realized there was a potential for shortage, we had donations of N95 masks and things like that, construction workers and even individuals who had remodeled their basement to drop off a stack of 20 masks. And, that was fantastic. And that was the preparation that was required to get ready. And then we thought we were behind the curve and we were racing to get ready. And then it's been this kind of quiet. Hopefully it's not the quiet before the storm, but it's definitely been a quiet. But the problem is that what we've seen is because people have this fear or they're trying to distance themselves from the potential of infection, they're neglecting some of their other potential signs and symptoms that would lead them to normally come to the emergency department. The guy who's been at home with chest pain for a week because he thinks I can just wait this out, or the woman at home who's been, gaining significant amounts of weight and ankle swelling, not realizing that it's her heart failure that's progressing and she needs to see a cardiologist or one of us to kind of get those symptoms in order. And so by the time that people are presenting, that disease has progressed much further than it normally would have.
I think one of the things to point out here is as emergency physicians, when we advocate for our patients, we always use this term prudent layperson, and we want to make sure that everybody has access to care in the emergency department for symptoms that a prudent layperson would go and seek care for. And we definitely don't want that to be any different during the coronavirus
Well, kind
pandemic.
of explain what you mean by prudent layperson, because those are actually words that I would understand if I even...
So a prudent layperson would be your average citizen who has average healthcare knowledge. If they have symptoms that they believe might be due to a serious or life-threatening condition, they would go and seek medical care. And we want that to happen during coronavirus just as it would happen at any other time. We definitely don't want people to delay their care or to be scared to come to the emergency department. Or, quite frankly, there's been a lot of the movement for, stay home to protect us, stay home to protect your healthcare workers. We're safe. We are very fortunate at St. Luke's and in Cedar Rapids that we at this point don't lack for PPE, and we feel very safe and comfortable taking care of patients. So we worry about yourself, and we have the ability to take care of ourselves too.
Yeah, I remember when we first started going into rooms over a month ago with masks on. Our patients weren't accustomed to not seeing our faces, but very quickly, I'd walk in, I'd say, it's something to the effect of, "Hey, I'm sorry I have to wear this face mask. It's just for your protection." And patients were instantly thankful and would show their gratitude. "Oh, no, thanks. I understand." They very much understood that. And now it's just part of the routine. Now people, I think they'd be shocked if you didn't come in wearing a mask and goggles. And sometimes I'll kind of pull down my mask and just say, "Hey, this is me, what my face looks like. I'm Ryan," and et cetera. And, that just kind of set them at ease a bit. But to the same regard, you talk about like severe illness. Well, a good friend of mine, and won't say his name, but if he hears this, I hopefully he understands. But he called me up and he said, "Hey, I'm at the office and my hand looks terrible. I got a shard from my rake handle." Everybody's at home doing yard work because they don't know what else. Have you seen so many people walking their dogs ever before? But and so they're walking their dogs, doing yard work. But he gets a shard of his rake handle in his hand and thinks, "I don't know if I want to go see anybody about this." But by the next day, this thing looks terrible, and so he's got to come in. And if he would have come in the day before, it'd probably been removing the shard, but now he's got an infection. So it's even the little things that you got to make sure you don't let get carried away. in times like this. And like I said, you're safe if you come to the emergency department. We're here.
Yeah.
We'll keep you safe.
I bet if you asked him, if that would have happened last summer, would you even thought twice about going to the ER, to urgent care, someplace to
just
get
run right down
care
there?
Yeah.
Right. Yeah. It's crazy that we have to think this way.
Yeah, it's kind of crazy to ever picture ourselves actually having this kind of conversation, right?
Yeah.
Like
right.
where did all of our patients go? Where are they? We want you to come in, and we always did, but we're especially concerned right now because anecdotally we feel like we're not seeing the same number of cases of appendicitis and heart failure and heart attacks and strokes that we normally do. I was actually just talking to one of our surgeons the other night. I worked a string of night shifts, and the surgeon had to come in to take care of a patient in the middle of the night. It wasn't an appendicitis case, but we started talking about appendicitis, and she said, I can't remember ever having a call night where I didn't take care of at least one case of appendicitis. And she said, I don't think that I've taken care of an appendicitis case in the last 6 weeks.
Wow.
It's stories like that make you think, gosh, I sure hope people aren't staying
at home with that. But it also says like something about what our daily routines are that make us susceptible to just everything.
Yeah.
It's kind of indicative. You see the pictures of how less human activity impacts things. And you look at the pictures of where they'll show of Beijing, and the air quality is just, or Los Angeles even, and they show the smog count, and it's almost like to zero practically.
Oh yeah, all the pictures that you see of animals, coming into cities because there's no one out.
It's like deer walking in subway lines and things like that. It's it's kind of crazy. It's the Chernobyl effect, where the plants and animals eventually take it all back over. And
yeah. Well, other stories. Certainly, maybe people aren't having appendicitis as much. Maybe people aren't having other things as much.
You kind of got to assume that is happening.
But there are lots of conditions that if caught and treated early, will prevent much more severe illness. And I can even give a couple of examples of things that I personally have seen, even during this last stretch of shifts I just worked in, that simple things like a bladder infection being untreated and leading to a more severe kidney infection, or a sore throat being untreated and leading to a more severe abscess in the throat that needed to be surgically drained. And I don't know whether either one of those cases would have been different in non-coronavirus times, but those are examples of things that could potentially have gotten worse if the patient was reluctant to come in and seek care early for their illness during this time as opposed to any other time.
Yeah, I think that is critical. We'd actually, one of the things we are doing a lot is studying the disease. And so there is a ton of information coming out of the epicenters like New York and Washington and places like that. And so we see a lot of these kind of crazy presentations. And in fact, people assume that this is a respiratory illness, which it is, but it starts with, and we're not going to get deep into the symptoms of this, but it starts with some fairly benign symptoms. And what I do not want to do is scare people into coming to the emergency department. That's not my goal here. What I want to do is make sure that you're aware that it's not just cough and fever. It as often starts with bad headache and body aches. We all get headaches. And so if you just think you have your traditional headache and you can manage it with Tylenol or Motrin or Excedrin or whatever, do that by all means. But if you have an unusual headache or a headache that's unremitting or not going away, and it's accompanied by body aches, and you just feel like this is particularly unusual, those can be symptoms of COVID. And in fact, 40 to 50% of people start off with non-respiratory symptoms. So you have to pay attention to things like that. And while there isn't a treatment for COVID yet, it is important that you identify it early.
Well, and quite frankly, any one of those symptoms could be a symptom of another disease that is just as serious or more serious than coronavirus. And thinking to yourself, I know I'm not supposed to leave my house or go into the hospital if I might have coronavirus. It could be a mistake. We have all the precautions in place to keep you from spreading the disease to the healthcare providers and to other patients. And at this point, I think the message needs to be, look out for yourself first. If at any time you're not sure about the symptoms or you're worried or you think to yourself, under normal circumstances, I would definitely be going to the ER for these symptoms. That's what we still want you to think. Because we definitely don't want people sitting at home and feeling worse.
And at a minimum, call your primary care provider. We have an Ask a Nurse line here at Unity Point. You can always call them. They have telemedicine visits available. And we have a respiratory clinic that if you call your primary care provider, they can kind of get you in. If you think your symptoms aren't severe enough, by all means go there. But yeah, like in the middle of the night, they're not open, and so the thing is we're 24/7, we never close. We're here for you. And, like whether it's headache, if it's a crazy headache, it could be COVID, but it could also be that something horrible that needs to get diagnosed quickly. But you just, again, that prudent layperson, use your own best judgment. And if you feel like it's an emergency, trust your gut and come and see us. And, we're going to keep you safe. You don't got to worry about keeping us safe because we've got all that in place. And so we'll take care of you.
Yeah. Maybe we should go over one more time just the steps that we've taken. So first and foremost, I think a lot of people have their own masks now, and when they're leaving their house, they're typically wearing masks. But if you don't have your own mask, we have masks to put on you when you arrive in the ER. You're going to be met by a greeter, and they're going to do just a basic review of your symptoms and kind of help disposition you either to the respiratory part of our ER or the non-respiratory part of the ER.
Or you might go to the shed. If you come in and you say, I've got a mild fever, a cough, but I'm not short of breath, and you have some kind of just basic symptoms and you want to be ruled out for COVID, we'll send you to our shed. And at that point, we'll determine if you qualify for testing. Again, remember, because testing is limited, there is, you don't necessarily be tested. If you don't meet criteria from the state perspective, we might just tell you to assume that you could have it and to shelter in place for 2 weeks, and you have to be symptom-free for at least 72 hours before you return to activities outside the home. So again, I'll reiterate, even if we think that you could have it, not everybody qualifies for testing. So if you come in, we send you over to our shed and you walk through and they say, yep, sounds like you might have it, go home. Don't be offended. We're limited by supply and also by state regulation as to who we test. There is some new stuff coming out with some of the more rapid testing, but we're kind of late to get a lot of that here in Iowa because we haven't been the epicenter. So that is coming, but it's not prime time yet. So just understand that and have some patience. But so back to your point, so the process is to show up when you get screened.
And then we've got separate areas leading into the department. Some people might call it waiting rooms. Fortunately for us lately, we haven't had a need to have anybody in the quote unquote waiting room. And we hope to keep it that way. The emergency department itself is geographically very large, and we are separating respiratory cases from non-respiratory cases to the extent possible.
We clean the rooms extremely well. In fact, that's been one of the issues, is making sure we had enough of these, they call them PDI wipes, or these wipes that we wipe down every room every time that a patient leaves, regardless of your symptoms. And if it is a respiratory patient, that room is actually left to kind of settle, even for a period of time, depending on the type of room we have, before we even go in and clean it. So we're very prudent about, again, there's that word prudent again. But we're very careful about making sure that these rooms are cleaned to protect you as well as us.
And there are lots of steps in process in being implemented to prevent equipment use from being, from the respiratory patients to non-respiratory patients. Different processes for diagnostic tests, x-rays, blood tests, EKGs, things like that for patients with potential coronavirus symptoms and those who don't. And even at the end of the visit, different processes for physically even exiting the department than we normally have in place. So from start to finish, we have processes in place in order to keep everyone safe and to limit spread of the coronavirus in the emergency department. And we feel very good about it.
I'll tell you what, we're probably close to the time that we have available to us. I will remind everybody that if you have some further topics that you'd like discussed, whether it's COVID-19 related or other health questions even, Dr. Arnold does this podcast regularly, and he'd be more than happy to answer any of those questions. So if you want to shoot those questions to the following email, St. Luke's CR, that's STLUKES CR @unitypoint.org. If you send your questions there, they can have them prepared for some good answers the next time Dr. Arnold does it. But we're happy to see you in the emergency department and ready to see you if you need us. Anything else to add, Dr. Dowden?
Unity Point has COVID-19 information on the website at unitypoint.org. And everybody, Iowans, keep up the good work.
Yeah.
Wash your hands, cover your cough, continue social distancing. We've done a great job flattening the curve here and,
really have.
And hopefully preventing any kind of a surge.
Yep. Nice work, folks.